Well, the priorities always is to, in immunizations, in the side of service delivery, or we call it vaccine delivery, you know? And we have 6 strategic goals. To give you one highlight of them is, for example, eradicate polio. You know? This is something that we have to do. We are very close to do it. And you know, in Nigeria, Pakistan, India, we have done a tremendous job with the international community, the UN, WHO, UNICEF, other partners in the ground. So one priority, big priority, has been polio, and we should finish the job with the new introduction of IPV vaccine. A second priority will be, has to do with the equity and the coverage in priority countries. So especially India, you know, important country. You have Ethiopia, you have other countries who are also affected, like the French-speaking countries. But those are becoming more and more important, as we have seen with Ebola, failure states. And so those are getting more and more interest. Other areas are also coming strong is the vaccination of adults. That is coming also strong. In the integration of maternal vaccines and other type of vaccines are growing in the field of new vaccines and new technologies. So we are interested on particular in those areas, on the new vaccine, the financing aspects. And one of the big priorities to contribute to GAVI. The GAVI Alliance is one of the things that we are very interested to work for the 75 countries who are GAVI eligible. So it's important that GAVI continues to be a successful story. We need it strong to make things happen together with industry, together with academia, together with different countries, priority countries, because we can really keep up the gap of vaccines, and we are committed to really to make it happen. It's an excellent question. I really enjoyed the 3-day conference. Multiple partners from the academia, from the applied research, from the evaluation areas, from the ministries. We have people from Senegal, we have people from Peru, we have people from Nigeria, who is a priority country for us. So I think there are some lessons that I'm taking home now, saying that, you know, the decade of vaccines, and they had this roadmap, and the demand side of that roadmap kind of weak. And I think this forum is helping us contribute to think, okay, how do we engage in the demand in a way that we don't, that we inform correctly, so that the demand is generated in a positive manner, and we are not creating platforms to misinform the community. So I think it's important to engage with blogs, we engage ourselves with infographics and other things, but have that in the context to really, in the positive context on introducing new vaccines. And I think the studies that have been shown from Australia, from the professor's experience in Australia, the experience that we have even in the University of Washington with medical interface of patient care, which is another model. So we have seen different approach to demand and response and to inform decisions. So we have now to still, I guess, gather this evidence that's been shown today and make it more compelling. Maybe Motivate is a good platform to circulate that information and make it more specific, so that we understand and the countries understand, you know, in the developing world. That's one strategy, but maybe in European countries, US, others requires also another approach. So I think that we will have more clarity on the follow-up of the conference, and I look forward to see what the network, or what this is going to go somewhere, and hopefully Motivate will keep the network alive. And I think the Fondation Merieux and Sanofi has put this platform for discussion. I think it's a good moment, and And we appreciate very much innovation in the foundation, and so I'm very glad to be here.